start the proceedings of this online virtual roundtable titled National Recovery and Preparedness for the Pandemic. I'd like to take this opportunity to welcome all of you who've taken time out of your busy schedules to join us today for this important discussion. Before starting the proceedings for the day and inviting our esteemed panel of speakers to share their thoughts on this important topic, I'd just like to give you a brief background about this virtual online roundtable that we are having. So, I'll just like to introduce myself. My name is Kshitij Gupta, and I am a project manager with the All India Disaster Mitigation Institute. We work in the areas of disaster risk mitigation, sustainable development, and also climate change adaptation, mostly at the local and subnational level, but also try to work with the donors at the international level and the UN system too. So that is a bit about us and our work. Now, why are we having this roundtable conference? So we believe that the COVID-19 pandemic was perhaps one of the greatest challenges that confronted humanity in recent times. And not only did it impact human health, morbidity, mortality, and our economic systems, but it kind of permeated into the entirety of our social and economic systems, meaning that no activity, no human activity or endeavor was unaffected by this pandemic. And you would know what I mean. Not only did it affect business and the economy and human health, but it also affected the pandemic, also affected the way we perceived and engaged with the world. And that can be seen the way the pandemic has affected arts and aesthetics and the way we now socialize with the outside world. Uh, the concept of work from home, the concept of working remotely kind of gained traction during the pandemic. And despite the pandemic being at its tail end now, hopefully, the concept still persists. So it has changed us in a lot of ways. And I think it is a good time for us to kind of take stock of all the lessons that this pandemic has taught us so that we may chart a course of a robust recovery and preparedness, lest we repeat the same mistakes and find ourselves in the same unprepared state that we were for this pandemic the next time a pandemic comes knocking at our door. So, in order to do that at the national level, we need to have a variety of perspectives from a diversity of stakeholders. And I'm happy to inform that this is the objective of today's roundtable discussion, wherein we have an esteemed panel of speakers who would like to share their insights and knowledge and wisdom on the theme being discussed, which is national recovery and preparedness for the pandemic. I'd just like to briefly introduce all of our esteemed speakers for today. We have with us Miss Eileen Morrow. Eileen, are you there?
I am. Can you see me okay?
Yeah, hi Eileen. Nice to have you
Hi.
on board with us. Good afternoon from India. Thank you for joining.
Morning from Ireland.
Yeah, hi. So, Eileen is a senior policy and advocacy officer with the International Council of Voluntary Agencies there in Ireland. Then we have with us Dr. Kesar Chand. He is from GB Pant National Institute of Himalayan Environment, Government of India. Dr. Chand, sir, are you there?
Yes, good afternoon, Kshitij.
Good afternoon to you, sir. Very happy to have you on board with us today and waiting to listen to your wisdom and thoughts on the subject. Then we're supposed to have Mr. Bashab Sarkar. He is the humanitarian program coordinator of Oxfam India. Unfortunately, Mr. Sarkar is engaged in some kind of a field assignment and may not be able to join us later, but he's been kind enough to share his presentation with us, and I'll be presenting on his behalf. Then we have Mr. Tirtha Prasad Soikia, sir. He's the Assistant Director of NEEDS India, which is Northeast Affected Areas Development Society. Tirtha, sir, welcome back again, and so happy to have you. And finally, we have Ms. Dhriti Pathak with us, who's a consultant with UNDP India. A very warm welcome to you, Dhriti ma'am. Thank you so much for joining us. Yeah. So these are our esteemed speakers for the day. And just before starting out, just a bit of housekeeping rules. Every speaker will have 10 minutes to share their slides and speak to the audience. And after every speaker has done so, uh, towards the end, we'll have a question and answer round where the participants can have their queries, shoot their queries at our speakers, either in the chat box or they can directly do so too. While I would prefer that if they type their queries in the chat box and I can read them out to our speakers, that would kind of make the entire format a little more clean and a less, very less chaotic. And finally, there'll be a conclusion and a way ahead by our director, Mr. Mihir Bhatt. Uh, if he'll be joining us quite soon. So whenever he joins, we'll also invite him to speak. So this is the background that I wanted to bring. I think
Mihir
sir
has joined. Yes, I
Okay.
have joined.
Okay.
Yeah.
Good afternoon, sir. We'd
Good
like to hear from
afternoon.
you, sir.
Good afternoon to all the participants and the panel members. And of course, good afternoon to you. I'm very delighted that this whole recovery and preparedness related to pandemic is being discussed. And we'll be also launching some work that AIDMI has done on that. And Kritip Bhai or Manish Bhai to put the publication on the chat box and subsequently also share it with the rest of the participants. Of course, you can also email that, email us the request, just to get the questions going and the objectives and the flyer you have. But I wanted to request the participants to, and the panel members to make it even further focused, and 4 areas which have come out from subsequent work that we have done with the pandemic. And 4 areas are this. If you have any action related recommendation as far as the financing is concerned, that would be very useful, because that's something which repeatedly at national level, state level, and subsequently also being felt at other levels as well. So that's one. Second, because somebody will have to do the pandemic preparedness, and preparedness costs time and money, and when's that money going to come? So second area that if the panelists and subsequently others also focus is on the management of the pandemic, and 3 things have come out quite clearly from the Indian experience. One is that wherever there was, of course, nobody knew this is coming, but as soon as people started making plans, the performance was much better. Where they took long time to make a plan, the performance was not so good, and where plans were not made, they were quite chaotic. So that's the broad sort of picture. So all the good performance, by and large, could be attributed to good planning at the city level, district level, state level. So any recommendation related to that would be very useful, sub-natural process. The third is in terms of a lot of work is being done all across India, and we will hear that also what's happening across global picture as well. Eileen, thank you for bringing that to us. What we need to do is that being more aware of the solutions than the impact of the pandemic, and what is it that we don't need to wait anymore and can start learning from each other, both within the country but also globally. So that is something which would be very useful to focus on. And fourth area, where for the action purpose, of course, you make your presentation to share your work, would be to look at, may God forbid, and I'm very hesitant to say so, that may God forbid, should there be two pandemics simultaneously, or should there be a pandemic and a severe flooding across South Asia or across, how would we deal with this rather overwhelming, huge, uh, um, and obviously, most of us are not prepared for that. But how do we start even thinking about it? That when the scale and the impact are far beyond what we know now. I very much hope and pray that doesn't happen, but I think that's not enough. So anything on how to anticipate unusually large scale and addressing that. These are the four areas I would like to suggest. We have some other meeting, the big meeting, the follow-up, which is the planning commission used to be, now it's committee, and something which is for the national plans. And I continue being here, but in case I cannot for the last few minutes, then I was going to request Kshitij, if you could conclude around these four areas, and
Yes.
and that would be the way ahead as well. So I mean, we don't need so much of conclusion, but way ahead. So how do we push this so pull it in the further? And one thing which is not very clear to many people, and that's about the vaccination, and what more can be done about vaccination beyond what the vaccination agencies are doing. So that would be part of this effort. Thank you very much, and I welcome again the panel members. I really appreciate you finding time to spend, and I appreciate the special issue that has come out on National Recovery and Preparedness for the pandemic, and congratulations for that thing. And all the participants, I'm very glad that you have joined. Any suggestions, questions, you could do it during the session, but feel free to also email us, because we may not have enough time and we could respond. Thank you so much.
Thank you, sir. Thank you indeed for sharing those words with us. You've given us a direction to think to all the participants as well. And just as you said that we are happy to bring forth our latest issue of South Asia Disasters.net. It's AIDMI's bi-monthly publication on disasters, climate change, and sustainable development in South Asia and beyond. I'm sharing a link of that in the chat box with everybody. And just for a brief moment before we start with our panelists, for a brief moment, I'd like to share my screen and give an overview of what this issue is about. So I hope my screen is visible to everybody. As you can see, this issue of South Asia Disasters.net is titled National Recovery and Preparedness for the Pandemic. And not only does it question whatever course that needs to be charted for robust recovery and preparedness at the national level is discussed here, but it also brings together a lot of perspectives from people working across different levels, be it the subnational level, the national level, the regional level, in all kinds of capacities. We have people from donor agencies who contributed to this issue. We have people who are working with civil society organizations at the ground level who've contributed. And we also have lived experiences of actual community members in this issue. So I encourage everybody to please have a look and do go through our special issue on this theme. Thank you again. And without further ado, I'd like to now invite Miss Eileen Morrow from ICBA to please start with her presentation and share her thoughts with us. Over to you, Eileen.
Brilliant. And thanks so much. Namaste, everyone. Miran, I'm Eileen Hai, and I had the privilege of visiting your fascinating country about 20 years ago, and it's a joy to be here today. So for the past year, I've been supporting ICFA members in humanitarian contexts to engage in the COVID-19 response. So for those of you who don't know, ICVA is a global network of over 146 NGOs in 160 countries, all of us working to improve principled and effective humanitarian response. I've had direct experience of engaging in national COVID-19 response during my time as country director with Concern Worldwide in Ethiopia, and then as forum coordinator for the Humanitarian INGO Forum in Ethiopia. And I was part of the humanitarian country team and the national COVID-19 response plans. I've also listened to a lot of NGO experiences in engaging on COVID-19 in the last year. And so I'm here to speak to you today from Dublin about NGO engagement in national plans for pandemic preparedness and response, very much from a global perspective rather than from an India perspective. And I'm really looking forward to hearing more from you about your experiences there. It's fantastic to see ADMI's leadership in this space, as there is enormous pandemic fatigue across most contexts, and yet still so much to do to respond to COVID, to start the recovery, and never mind preparing for the next pandemic, which is likely just around the corner. So the secondary impacts of COVID really have taken primacy now. It's extremely difficult to get the bandwidth to respond to the ongoing crisis, and also very difficult to get people to meaningfully engage and prepare for the next. People are just so tired. I think that the term that comes to mind is we're sick of sickness. We're sick of talking about sickness. And yet there's still so much to be done. Most countries are not ready for another major disease outbreak, and poor, marginalized and fragile contexts in particular are extremely vulnerable, and not enough ground has been gained in terms of response and preparedness. So for national planning in many contexts, they face a number of really difficult dilemmas for pandemic preparedness and recovery. And I wanted to speak to 5 key areas that national plans across the world need to anticipate for and draw experiences from how we dealt with the current pandemic. So the first is that national plans need to anticipate and mitigate against a slow initial response.
Eileen, pardon the
Yes.
interruption. I'm very sorry for interrupting you, but would you like to share your slides also?
I don't have slides. I'm just talking
Okay.
today. So, yeah. Okay. So national plans need to anticipate and mitigate against a slow initial response. Most countries did not react quickly when WHO declared a public health emergency of international concern on the 30th of January in 2020. It took the declaration of a global pandemic almost 2 months later to get countries to start taking action. And by that stage, it was too late. So can you imagine if we had another global pandemic declaration now? As I said, we're sick of sickness. It's going to be extremely hard to sell control measures to citizens and to governments even. Nobody wants to go back to restrictions, but they might be needed for another disease outbreak. So some countries already that we're seeing experiencing severe disease outbreaks are really struggling to step up the needed response, because no one wants to go back to having surveillance and control measures at scale. So managing this buy-in for a new pandemic response, for new pandemic response measures, really needs to be planned, and good communication strategies are key. And this is so hard because we know many people don't want to hear about pandemics anymore, and they just want to get on with their lives. But we also know that diseases don't care, and that we need a rapid response to be effective. And so this is the perfect environment for a disease to really take hold. And this is one reason for engaging NGOs who have ways of really connecting with people. We're specialists in communication strategies and knowledge behavior and attitude change. So it's really important that NGOs are brought on board in developing communication strategies that bring people in and create buy-in. And it's so important that we get this right in future plans, because effective pandemic response means moving quickly. The second area is that national plans need to anticipate a poor reaction from some corners. We need to expect pushback. I always assumed that when we're faced with a collective problem, that all of humanity would rise up and work together to solve it. And we have seen some incredible collaboration happen, incredible solidarity. For example, we've gotten effective vaccines in a very short space of time, and that has saved millions of lives. However, we've also seen huge misinformation, we've seen polarization, radicalization, and huge pushback against public health measures and just common sense in general from some parts of the population. And it's been very much politicized. So we need to plan for that. We need to expect that as we move forward. One of the drivers of this, I think, is that we've had this whole top-down versus bottom-up planning process and implementation processes. So in the rush to respond, or the sudden rush to respond, a lot of the planning was very top-down. It was very directive. And that caused a lot of discomfort amongst the population. So it's really important that we have a connection between bottom-up planning processes and national plans, as well as the top down, so that we're bringing people together. And again, NGOs are a key partner in facilitating this, as they work hand in hand with communities to plan and implement. And that really greatly increases acceptance of any measure. The third recommendation for national plans is to finance coordination and incentivize it, okay? Coordination with all stakeholders is absolutely key to ensuring that a public health response is effective and that there aren't gaps and duplications. National plans need to invest in coordination mechanisms from local to national level and ensure that all key stakeholders are at the relevant tables. And that means governments, UN bodies, NGOs, religious leaders, private business, media, medical representatives, researchers, the list goes on and on. But it's so important that we coordinate across sectors. And one approach I wanted to share with you that's worked really well has been this one team, one plan, one budget approach that was taken on by the COVID-19 Vaccine Delivery Partnership. And they're a global interagency team comprising of WHO, UNICEF and Gavi that aim to help countries reach the 70% WHO target of COVID-19 vaccination coverage. And they ask all actors from all parts of society to share information on their COVID-19 response plans, their budgets and resources, so that they can come up with a cohesive one plan, one budget, and prevent gaps and duplication. It's not always easy because some stakeholders are not readily prepared to share their budget figures, for example, but this transparency is so important for ensuring a really coherent response, and it's essential in fragile and humanitarian contexts. So coordination isn't easy. We know this. It can be really difficult because it relies heavily on relationships and personal contact. And a lot of that was restricted during the pandemic. Working online has opened up a lot of opportunities, but it also closed down a lot of genuine collaboration and trust. So even now that we're back to in-person working, there is still a lot of trust to build, a lot of coordination to happen. And NGOs, just what I've seen from engaging with a variety of countries is that NGOs really need to invest in building relationships and managing perceptions and building trust with government and with UN bodies, because there's still a lot of negative attitudes towards NGOs. We're often just seen as implementing partners or that we're problematic. So it's really important that all of our staff are communicating the value addition of NGOs to governments and to UN at every given opportunity, and building trust and investing in those relationships. So in terms of coordination, it's often not financed. We're often doing coordination on top of our full-time day jobs. We're often double hatting, as we like to call it. It's essential that national plans provide time and money in investing coordination so that we get it right. It's not an added or optional extra. Collaboration and working effectively together is the only way to stop a pandemic in its tracks. Fourthly, national plans need to anticipate that people will be impacted differently. We're not all in this together, as we were told at the start of the pandemic. The pandemic really highlighted global inequalities, whereby lower income countries or specific population groups were disproportionately affected by the pandemic in terms of access to food, access to basic services, and it really caused existing vulnerabilities to be further exacerbated. The pandemic is estimated to have pushed 97 million more people into poverty during 2020 and 2021. And daily labourers, particularly women, were really hit badly. So a lot of cooks and cleaners and childminders lost their jobs. We saw spiralling domestic violence. We saw early child marriage and child protection risks in so many places. And globally, 870 million children face disruptions to education, and 23 million people have missed basic vaccines just in 2021. I found personally the school closures particularly difficult, to be honest. Working from home with my children in the background is not really conducive to well-being, and my family was one of the lucky ones. So it's really to emphasize just how important education is, not just for our children but for our families and societies to be, you know, well functioning. People were really hit hard. Travel and movement restrictions aimed at containing COVID-19 really exacerbated the secondary impacts of the pandemic. We saw a lot of migrants and vulnerable workers trapped at borders in really severe conditions. We've seen huge setbacks in mental health too. People are not in a good place, and we really need to invest in welfare and well-being, as this is so difficult now. And it is so difficult to invest in social services now because the secondary impacts of COVID on the cost of living and also on conflict have left public finances in a really dire situation today. But investing in public well-being, in welfare, pays long-term dividends, and it ensures sustainable development. So safety net programs are so important to ensuring that the most vulnerable are protected and that we don't lose any more gains in development. And NGOs are key stakeholders in providing livelihoods, recovery programs, and there are so many excellent examples, including in India, of sustainable development programs that NGOs have provided, and these can be expanded with the right support. And so finally, national plans really need to leverage all stakeholders. And this links to the points I've made earlier. In almost every country, we've seen a almost fully government or UN-centered pandemic response for COVID. And while this is absolutely key for reaching the majority of people, it also means we've missed marginalized communities who are not always able to access government services. Reaching the most vulnerable and marginalized is what NGOs are best at doing. It's what we specialize in. And many vulnerable communities don't necessarily trust government services. In many contexts, NGOs were provided with vaccines by government to support the response to marginalized communities, to humanitarian communities, but were not provided with any financing to do so. So national plans really need to find ways of financing non-government organizations and giving them a seat at the table so that we have a response that reaches all parts of society effectively. So in conclusion, as Mahir has also said, we have learned an awful lot from the COVID-19 pandemic, and now is really the time to embed this learning. This will take a lot of work and energy is low now, but if we don't embed it now, we will make so many of the same mistakes again in future. Again, I want to thank ADMI for their leadership in this important discussion, and I really look forward to hearing from the other speakers. Thank you.
Thank you so much, Eileen. That was quite insightful. And we can see in the chat box also that your keynote address at the beginning has kind of given everybody some serious food for thought, whether it was the need for national plans to anticipate that everybody would be impacted differently. I mean, it's something that we all wanted to say, but due to being the atmosphere of political correctness, we weren't able to address that issue. But perhaps you've sounded the alarm on the right note here. And just to give you an idea of how things shaped up in India, I'm sure you must have followed how the Indian government announced a lockdown at the starting of 2020. And it was such a strict lockdown that not everybody was impacted in the same way, in a sense that migrant laborers in India who work mostly in the informal sector without any social safety nets, and their source of earning was daily wages, they found themselves without those daily wages. They had to go back to the countryside from whence they came. So that kind of spurred an exodus of informal migrant workers from our cities to the countryside. So we totally understand when you say that there's a need to do that. Similarly, the important point on children being impacted, well, the education is disrupted in India. I mean, if you were to just to give everybody a sense of how many school-going kids actually study in India. So if by the last estimates of Niti Aayog, which is our planning commission, if the entire chunk of children who go to school in India were to be divided into a country, then it would be the fifth most populous country in the world. So having so many children's education being impacted for close to 2 years is a big thing. While a lot of private schools were able to provide uh, online classes, it wasn't the case for a lot of underfunded public schools here in India, or for that matter, any other developing country. So that's also an important aspect that you brought about. And finally, I guess everybody is tired of pandemic, and everybody has the pandemic fatigue. Perhaps that is why we were also afraid that when we organized this roundtable conference, not a lot of people would join, but we've been proved wrong. And thanks to you for bringing that point to the fore too. So thank you again for sharing your insights. Please do stick around for other discussions, and I'm sure there'll be lots of questions for you at the end of the session. Thank you again, Aileen. So after Ms. Morrow's keynote address, I'd now like to invite Dr. Kesar Chand. He's from GB Pant National Institute of Himalayan Environment, Government of India. So, sir, over to you.
Can you hear me?
Yes, sir. We can hear you, and we can see your screen also.
Okay. Okay. Nice. So thank you, Kshitij. So I would like to thanks AIDMI Institute and its entire team, especially Meher Bhatt. So inviting me to share my views on like pandemics and what Himachal Pradesh have done during the pandemics. So just now I would like to take you in the hilly state of Indian Himalaya. So as you know, more than 2 years coronavirus infection were reported, and the COVID-19 pandemic remains a serious global emergency. So the state of Himachal Pradesh reported its first case of COVID-19 on 20th March 2020, and 2 people were tested positive for the coronavirus in district Kangra of Himachal Pradesh. So it's not moving, I think so. Okay. So as you know, Himachal Pradesh is one of the hill state of country which has limited source of income, and its geographical area is 55,673 square kilometer, and having 6.86 million population. So Himachal Pradesh has strong economic growth, and it is one of the fast growing states in country. The Himachal Pradesh is a major tourist destination, and if we talk about the contribution of tourism to Himachal GDPs, it is near about 7%. So industry sectors contribute to GDP around 30%. So the Himachal have the agriculture productivity and horticulture productivities and its heritage like handicrafts, which is the real source of the income. So, but due to pandemics, these all sources were badly impacted. So what impact have been seen by the Himachal Pradesh during pandemic 19? These are the employment sector. As I know, Himachal Pradesh provide near about 3 lakh jobs to migrant laborers, and which was badly affected by the COVID-19. So Himachal Pradesh is likely to register like negative growth of 6.2% in financial year 2021 due to the adverse impact of COVID-19. With the tourism sector, like it's shrinking about 81%. It's huge numbers. So the education system is drastically affected by the COVID-19 pandemic. The nationwide lockdown imposed the closure of school, colleges, and other institutions of the Himachal Pradesh. So religious gathering and agriculture activities were reduced due to COVID-19. So so overall, we can say the Himachal Pradesh faced a low GDP during this pandemic. So As you know, like apart from the COVID-19, Himachal Pradesh is most disaster prone, prone area for natural as well as man-made disaster. So man hazards consist like earthquake, flash flood, cloudburst, forest fire, droughts, and etc. So right now the total number of infectious cases was like 3.13 lakh, of which 3.08 were recovered, and total number of deaths we have reported in that time 4,200 uh, 4,211 due to pandemics. So, and different initiatives and preventive measures were taken by the government of Himachal Pradesh to mitigate the impact of uh, like COVID-19. So Himachal Pradesh had taken small and impactful steps to curb the impact of COVID-19, like restriction and seal borders to curb the inflow of outsiders, stop tourism activities and the religious gathering to minimize the infection. And you will see in the photographs during restriction, government agencies took hard steps like proper monitoring of mask and body temperature and sanitize all the public as well as private premises. So these are some of the preventive measures taken by the government of Himachal Pradesh. So Himachal government took some strict action for identification of infected person with the help of ASHA workers, Anganwadi workers, and some panchayat personals. So government checked proper quarantine facilities as well as quarantine times of infected people with the help of various departments. During COVID-19, government channelized all concerned departments to look after the situation of COVID-19. So in these photographs, you can see some of the measures taken for identification. And other measures, as you know, during the COVID-19, scarcity of masks and kit were found. So with the help of local women and self-help groups, the scarcity was covered with the help of these women. So with the help of local NGOs and volunteers, home delivery of like vegetable and medicines and grains were being ensured in urban as well as rural area of the states. So telemedicine facilities were executed to avoid unnecessary travels, and government separate the OPDs and routine checkup of the patient in temporary tents. So these are some of the other measures which government have taken. So some grassroots level approaches were taken by the government of Himachal Pradesh in the pandemic, like distribution of packed food and grains to migrant laborers, general awareness about the make sure physical distance and wearing masks. So local people were taking initiatives of temporary employment generation to migrant labor with the help of their local available source like horticulture crops and other agriculture productions. So government of Himachal Pradesh has developed various information and technological initiatives such as Kobo tools and portals, issuing of e-curfew pass, and to minimize the impact of pandemics. So what government have taken sustainable recovery and preparedness in the future? So government of Himachal Pradesh has used the term building back better, which is given by UNDRR to recovery, rehabilitation, and reconstruction phases after a disaster to increase the resilience capacity, to revive the economy of the state by designing packages like, and second one is Mukhya Mantri Shahri Rozgar Guarantee Yojana. In this scheme, government provide 120 days of assured employment to the urban population and provide rupees 2,000 per month to register workers of the state to help them to overcome the economic crisis. So for worst affected tourism sector, the government has waived of electricity demand charges for 6 months, and excise and taxation license fees were waived off to the hoteliers. So now my concern is that what lesson we learned from the COVID-19. So I think we are aware about the we have faced masks are a useful tool and to minimize the its spread, and telehealth technology are useful for the future and improve the capacity of resilience of local people and government agencies. And last one is, I think, community participation. is the most important to curb the pandemics. So these are my thoughts and like some experience which I have shared. Thank you very much for your listening.
Thank you, Dr. Chand. Thank you indeed for sharing your thoughts and your insights on how Himachal Pradesh has managed the pandemic and what more preparedness measures can be taken at the state level to avoid any kind of emergencies in the future, health crises in the future. I'm sure everybody will have a lot more questions for you in the question and answer now, but I think it's time for us to move on to our next speaker. We're supposed to have Mr. Basab Sarkar, but since he's not joining us because of some emergency, I'd now like to invite Mr. Tirtha Prasad Saikia, who's the Assistant Director of Northeast Affected Area Development Society on Needs in India. Tirtha sir, are you there?
Yeah.
I'll just start sharing the screen as you requested.
Yeah, please do share at your end, sir.
Yes, sir.
Okay. First of all, I'd like to check, am I audible clearly to you?
Yes, sir, you are.
Okay, thank you. Yeah, good afternoon, everyone. It's a privilege and honor for me to be part of this National Roundtable meeting on National Recovery and Preparedness on the pandemic. Thanks to All India Disaster Mitigation Institute for inviting to be part of this panel and to share our limited experience that we had while carrying out responses and preparedness activities for pandemic in Assam, in the context of Assam. Just to introduce our organization, we are Northeast Affected Area Development Society, based in the district of Jorhat, in northeast part of India, in the state of Assam. And we are one of the community-rooted organization and working in the local level with support from different national and international organizations in different communities. So basically, we are working in the areas of humanitarian response and advocacy, disaster risk reduction, climate change adaptation, sustainable development, and human rights issues as well. The topic given to me is on pandemic preparedness, what we assess or what do we think about the preparedness in community context. So I'll be sharing experiences of responding to COVID-19 at the very front line, being based in the community as organization. Next slide, please, sir. Okay, the significant aspect is that we understand COVID-19 pandemic, which is one of the global problem, but the risk that is faced by community, that was very local. The pandemic was striking almost all countries globally, but the risk, secondary risk, or the allied disaster that is being created from the pandemic, like malnutrition, food insecurity, public health problem, lack of education, then economic crisis, all these have been created because of the pandemic. Even though it was started globally, but it was affecting the community at the very local level. So I think as being responding to this pandemic situation, it's very important that the pandemic need multi-level collaboration and effective preparedness and response at any level. Being an organization, being a civil society organization responding to the community, I think we address the risk that is coming out from this pandemic. We need multi-level partnership and collaboration with the other intermediary organization and donor agencies as well. At different level, at community level, at state level, administration level, or maybe at national and international level. So that's the significance of working with the pandemic situation, and then we can realize how it is affecting the community at the very local level. Next slide, please. The areas where we are intervening, mostly it is Upper Assam region in the state of Assam. The context was like when the pandemic was striking, when it started mostly in the beginning of 2020, yes. So in 2020, along with the pandemic, the other problem started in Assam, which is the recurrent flood situation. Since 2020, also in 2021, including 2022, these 3 years, along with the pandemic, people have been affected with severe flood situation because of many factors like flood that is caused by rainfall in the hills, flood that is caused by development-induced disasters like release of water from the dam, and many other issues related to floods and riverbank erosion that actually created a lot of problem in the riverine areas, in the forest communities, tribal areas where communities they were facing twin disasters of pandemic and flood. At the time when people of Assam were battling against COVID pandemic, the same were also preparing how to tackle the multiple waves of rising flood situation that were really very pathetic. The impact of COVID-19, the pandemic was being felt everywhere in Assam, which was hitting the poor and the marginalized the hardest. And needs, we as the local civil society organization, we had been making every effort to anticipate and at the same time working out with necessary preparation for responding to the impact to improvise and vulnerable communities, like those who are located in tea estates, those who are living in the floodplain areas, those who are in the tribal communities and the distant areas. We have been targeting all these communities with our immediate response to save lives. At our organization level, we had come out with one rapid response team, which have been engaged to carry out all vital services to the every extent possible, and they stand ready to address immediate concerns in the community at risk, closely coordinating with the local administration. So at this point of time, particularly in 2020 and 2021, for both the phases of COVID, phase 1 and phase 2, we had been working with the close coordination with interagency group and the local district administration and the block administration to figure out responses and also to carry out some of the vital services with them. The last point is that, which is very important, we were focusing on public health preparedness, also protection of people's rights and mitigation of larger social and economic impacts in the long term at the face of such unprecedented crisis. One of the larger area was the economic crisis, also public health preparedness, and also working in the areas of long-term sustainability. Then I think we need to connect with the people's rights and mitigating larger social and economic impact of the pandemic in those situations in the context of Assam. Next slide, please. Next slide, please, sir. Hello. Sorry. Okay, these are some of the snapshots that we had of our response that we had undertaken in communities in different areas of Assam. Next slide. Yes, this is one of the vital area, the community-based disaster preparedness. When we talk about the preparedness of pandemic at the national level, definitely we have to have some sort of nexus with the community-based COVID preparedness. Like we talk about community-based disaster preparedness, I think disaster preparedness cannot be completed without including right now the COVID preparedness, which is very important. I think the number one is that in order to mitigate the risk of twin disasters, like in the context of Assam, flood as well as the pandemic, among the most vulnerable and the marginalized, as organization, we started the thought of community-based COVID preparedness through its already existed village disaster management committee and further community organization based in the floodplains. So in our regular disaster risk reduction and climate change adaptation program, already we had promoted this village disaster management committee or village disaster response force, who usually work in the areas of flood preparedness or disaster mitigation exercise. So these institutions have been well accommodated to find out cases related to COVID, to set up community-based COVID quarantine center, to find out, to track individuals or family who have been suffering with a lot of COVID complications and all. So it was kind of a practices that was being evolved in the areas of community-based COVID preparedness. Another area is that we had provided the support of early detection of COVID-19 kit we have given the early detection of COVID-19 kit to the frontline health workers like of Anganwadis and Asas and also the community leaders, so that it helped to improve the capacity and the pandemic preparedness of local communities and imparted capacity building training among the frontline health workers for better handling the COVID situation in the communities. providing training on preparedness, building capacities, how to tackle situation at the very local level. That was very important. And we have seen cases in the areas like of Jorhat or Majuli or Golaghat or in the tea estates, how actually they have come up with such innovative approaches of handling the situation at the very local level with support from different administrative authorities. Then we had taken effort to promote COVID appropriate behavior among the vulnerable communities, which was critical to break the chain and contain the pandemic from the community spread. Then another areas is that community outreach and mobilization. There was one of the emerging need in communities, which resulted in fighting vaccine hesitancy and boosting demand among people. Also to extend our support in rollout of vaccination campaign in the ground. So hesitancy to get the vaccines at the community level by different community groups like of women, tea estates worker, tribal communities. There were a lot of misappropriation or rumor or interpretation that getting the vaccine might occur long-term diseases in them, in different family planning and other health issues. So it was kind of difficult for us as well to convince them. So this community-based COVID preparedness was actually capturing all these issues in convincing community and making them psychosocially strong to come up with these efforts. And needs was in action to meet such immediate needs with the volunteer support among the most vulnerable groups affected by COVID-19 in the second wave, particularly. Next slide, please. This is the community-centered vaccine adoption program we had undertaken during especially in the phase 2 response of COVID-19. As part of the ongoing COVID-19 second wave response, we had launched this community-centered vaccine adoption initiative with support from different national organizations in Assam. And we were able to reach out to 75,000 vulnerable communities, marginalized families who were having a problem in accessing vaccine facilities at their own. The program was designed to strengthen effective collective efforts in the light of in the fight against COVID-19, which will reach out, especially in Assam, those who are vulnerable and the most underprivileged. Community COVID vaccination program at the identified blind spots where segment of local communities are not being vaccinated to ensure 100% coverage of all adult population, especially those most underprivileged. So it's like we have our own operational area. Normally, we ensure that there is 100% coverage of all adult population, especially in vaccination programs. For that, we reach out to each and every family and try to ensure that the family they have access to vaccination facilities, and even the administration they have that way to channelize all these efforts to cater these populations who are in real need. Needs was establishing local ground forces to work alongside frontline health workers and local health officials. Basically, we have been working with the block public health center, BPHE, then the sub-center at the village level, also with the district level with the different departments like Joint Director for Health Services and different COVID care center at the district. Next slide, please. So another important program was the Oxygen Concentrators Bank program. We all know how the scarcity of oxygen, it created havoc in many of the areas, including Assam, because of lack of oxygens. Many public health institutions, they were running in different problems and scarcity of many health facilities. So it was like a panic situation that was being created in many of the interior areas of Assam. So with the help of different national and local organizations, also the international communities, we were launching this Oxygen Concentrators Bank program, and where we had supported multiple public health institutions like BPHE, Public Primary Health Center, then district civil hospitals, subdivisional civil hospitals, with the oxygen concentrators that were being supported to us. We had given this systemic support to different public health institutions and hospitals where COVID patients were being kept. And we also reached out to we had reached out to COVID care centers, which are being located at very interior and isolated place in the state, with our organizational level oxygen concentrator bank program. And throughout the last response, we were able to reach out to, we had distributed 75 oxygen concentrators to these institutions, so that there is early rescue or early support to the patient as well, so that we can save lives, and there is no scarcity of oxygens as well at the COVID care center and the public health institution. Next slide, please. Okay, this is the short presentations that we have prepared, how with our limited resources being alone, as we try to respond to communities during the pandemic period and the flood period as well. So if you have any question or any query, if you have, or any further inputs, if you have, please do let me know. I'll be happy to address from my side. Thank you, sir, for providing this opportunity. Over to you.
No, thank you, sir, for sharing Need's wonderful experience of helping the communities in the Northeast with everything that they could have possibly required. I'm very grateful to you and to Needs for doing what was important. And two things you brought forth in your presentation that need to be discussed even more, which is addressing concurrent disasters. We all know what kind of flood situation Assam and some other states in the Northeast faced, where Silchar was submerged for an entire week. A major city of close to 10 lakh people being submerged for an entire week during the midst of the pandemic was quite a hellish experience, I'm sure. And also the second part of your presentation, wherein you say that any kind of community-based disaster preparedness nowadays needs to necessarily address COVID preparedness. I think that is a point that needs to be embedded in the functioning of all kinds of CSOs across the geography of India. So thank you again, sir, for sharing your insights with us. We'll now move to Ms. Thriti Pathak from UNDP India. We'd like to hear from her now. So over to you, ma'am.
Thank you so much, Shikit. Will you also be able to share my presentation?
Sure, ma'am. Sure, ma'am. Just give me a moment. Can you see my screen, ma'am?
Yeah. This is the first slide.
I'm sorry. I'm sorry. Yeah.
Good evening, everyone. Today I'll be speaking on environmental agenda for the pandemic preparedness in India. Actually, most of my points have already been covered because the previous speakers have great presentations.
Dhriti ma'am, one request. Your voice is breaking up. Can you speak up a little bit more? Can you bring the mic closer?
Should I use here?
Yeah. If that's possible, that would be much more convenient.
Hello.
Yeah, ma'am. This is perfect.
Okay. So let's go to the first slide.
Yeah.
So first, I'll quickly take you through this slide, which briefly touches upon the linkages between the environment and human health. One of the major environmental risks that are faced by humanity in recent years is climate change. The Intergovernmental Panel on Climate Change, which is the nodal body for scientific assessments on climate change, in its 6th assessment report, which was released very recently in 2022, it found that the instances of communicable diseases in Asia have increased significantly. Now, the changes in the climate are clearly therefore affecting the spread of viruses and are making diseases more common. Added to that are the increased intensity and frequency of climate-induced natural disasters, and the impact of which are much higher on less privileged groups and communities. Eileen mentioned this at the global level with differences between countries, and I wanted to highlight that even within a country there are huge differences that exist in adaptive capacities, which eventually aggravate existing differences. Now, coming to less privileged groups and communities, they're already dealing with developmental risks such as malnourishment, poverty, and so many other things. And added to this, if you add climate risk, it presents a whole new scenario, which then becomes much more intense and complicated to address. So, especially for developing countries like India, it prolongs and delays growth and development. And also, by how does it prolong and delay growth and development? It aggravates the already existing issues. So, in order to address this, what we require are robust systems that can address these concerns. Now, how do we define robust systems? So, at the very onset or at the very basic level, say an integrated system that will have the capacity to address developmental challenges along with new ones that may be presented. And I feel that this is the need of the hour currently. Next slide, please. So coming to the COVID-19 pandemic, I want to begin by stating that, the pandemic was something where, it shook and jolted most of us, and it showed us a mirror of what our current resilient systems are and how inadequate and, well, unprepared we are to handle risks of this nature. The pandemic also brought to the fore the importance of subnational actors. They are the first line of defense in case of any calamities. So usually for solving big issues such as a global pandemic, we usually look up to the central government. But the COVID-19 pandemic actually showed us how crucial the role of local actors are in times of crisis such as these, and their proximity to the affected area, their knowledge and understanding of local conditions are things that cannot be overlooked while dealing with such things. So, we need to acknowledge that their preparedness and their capacities are key indicators of our resilient systems. Another striking feature of the pandemic that I wanted to highlight today is that it was not an isolated risk. Tirtha Prasad sir mentioned this in his presentation, and I also, being from Assam myself, have witnessed people dealing with floods during the pandemic in Orissa, and not just in Assam, in Orissa, people were dealing with cyclones, several other states as well. So the pandemic basically happened while first of all, India as a country is already so diverse and has multiplicity of risks across the country. So we were already dealing and addressing several other different risks in our own capacities, such as someone was dealing with disaster risk, someone was dealing with climate change risk, and in developing countries like India, developmental risk overpower all of this, and it's the biggest risk that most of us are dealing with. This brings me to my next point, where we have a silos approach of handling risk. So when we're handling, we are actually pretty good at handling isolated risk in their respective silos. You give us a cyclone or a tsunami, we have shelters, we have evacuation plans, all set for handling it. You give us heat waves, there are guidelines, we know what to do. The issue arises when we have to handle compounded risk. That is, when two or more risks strike at the same time, then we are at a loss and we don't know what to do. And it basically becomes an out of syllabus question for us. And that is exactly when our resilient systems are actually being tested. And in this case, during the pandemic, we saw the entire system collapse. Next slide, please. Yeah. So what do we do now? How do we build back better? We, of course, need to update our resilient systems and equip them for handling integrated compounded risks. Now, a major risk that threatens almost all of humanity right now is climate risk. So I feel that, we need to synergize our recovery from the pandemic in a manner that enables us to be more resilient to the impacts of climate change. Like that is one risk we know for sure that is, coming up, and it's going to get more and more intense eventually. Mihir Bhatt sir earlier mentioned the issue of finance. And I wanted to highlight that, funds for adaptation to risks are very few and far between. And it's a major problem in developing countries because their impacts of adaptation, their impacts, they cannot be monitored and evaluated in quantitative terms. And the returns are not immediate and are not very good. So when we talk about finance, I think investment in resilience, in resilient infrastructure is a good way forward. It's a possible scenario, possible way forward. And our health infrastructure, for instance, it is a key aspect for resilience of any society. It needs to be upgraded definitely in India because, we need to meet the demands of a growing population. And this will not only contribute towards the recovery from the pandemic, but it will also build our resilience to future health as well as climate risks that will affect human health. And this will significantly improve our adaptive capacities. Another key to enhancing our resilience systems is to start local. We discussed earlier the importance of subnational and local actors in the face of such risks and disasters. So I think we need to start right there, build their capacities, provide them with adequate knowledge, resources, and basically equip them for handling risks of different natures. I also think it is important to note that most future risks will be compounded in nature. And so keeping that in mind, we need to update and upgrade our current approach to risk management, wherein there is a possibility of dealing with compounded risks. And coming to my final point, we also discussed earlier that our systems, even resilient systems, often work in silos with almost little or no cooperation and coordination with other departments. Now, that is a major drawback while dealing with risks, because risks, they affect all systems, albeit in different capacities, of course, but they do. And hence, in order for them to be addressed completely and fully, we need cooperation and coordination within our systems, within departments, and it is extremely crucial for building robust resilient systems. Thank you very much. This is all I have, and I hope I could contribute at least a little bit of meaningful insights to this very enriching discussion today. Thank you very much.
Thank you so much, Dhriti ma'am, for sharing your perspectives with us. You're selling yourself short and being too modest in saying that you think you might have contributed. I think you've contributed and have made the entire discussion bit more very rich and rewarding experience for your listeners. So thank you again for sharing your insights with us. Two things for the benefit of our participants, I'd like to reiterate two things that clearly come out of your presentation. The first one was the need for integrated and robust systems. I think in several ways, all the speakers before you have also hinted or directly addressed this issue by saying that there needs to be a coherence of outcomes that need to span across different verticals of the government as well as the non-government sector. In that sense, everybody would be geared towards working towards common outcomes, and we can obviously there's the risk of overlapping and redundancy of tasks, but that can be taken care of when everybody is allotted their specific task with one clear objective in mind. Right now, there's the silo approach that has permeated into official bureaucratic thinking here in India. So that needs to change. Similarly, there's also the importance of addressing concurrent risks, just as you said that whenever all our plans and guidelines come to naught, whenever we are faced with something that is unfamiliar to us, for instance, when we come across multiple disasters or multiple risks at the same time. So we need to understand how to adapt to that to improve our, how to respond to that effectively to improve our adaptive capacities. So thank you again, Tritiji. I will now start presenting Mr. Bashab Sarkar's presentation. He's from Oxfam. Unfortunately, he couldn't be with us today because he had a very important field engagement. So nobody from Oxfam could be with us today from his team. So he has requested me to present on his behalf. I'll try to do justice, but since it's not my presentation, please do pardon if I make any errors of omission or commission. So the presentation is called Oxfam's role in promoting the pandemic preparedness. The idea is to protect, secure, and preserve responding to the first wave of COVID-19. He says that the first wave of COVID-19 took the nation by surprise. Oxfam India's field team conducted a quick assessment of the situation, and in coordination with the government departments and local partners, Oxfam reached to 136 districts in 16 states of India with the most relevant support in a timely manner. Here are some facts and figures that so many people were reached in terms of ration kits and cooked meal packets. So many people were supported with PPE kits. There was unconditional cash transfer done by Oxfam India for close to 9,481 people. And it also supported 81 self-help groups with training on skill development and input assistance to initiate small-scale income generation activities. There was also the award-winning digital innovation Adhikar Vani that reached almost 1.7 crore people with the awareness message regarding COVID-19. Text messages on COVID-19 response and government entitlement sent through this VGCAN website was also there. During the second wave, Oxfam also responded effectively, and this was a part of their projects in Jeevani. So what happened between April 2021 and March 2022 was the strengthening of the healthcare ecosystem, support to government hospitals with critical life-saving equipment to 305 hospitals at the state, district, and PHC level across 16 states and Delhi. So this is the input that Oxfam provided to the government health infrastructure across 16 states of India. The provision of ASHA kits and training of ASHA workers. Oxfam India has the target of reaching out to more than 70,000 ASHA workers across the states of India. They've already reached out to close to 64,993 ASHA workers through training and kit distribution. Again, distribution of 13,500 PPE kits to doctors, nurses, and other allied healthcare professionals. Installation of hand wash stations, disinfection of COVID care centers, and distribution of sanitizers, spray machines, masks, etc. To adolescent girls and women. This was also done by them. And 5,086 safety kit like pulse oximeter, digital thermometer, sanitizers, hand wash liquids, etc. were also distributed by them among healthcare professionals other than ASHA workers. Food support was also provided in the form of dry ration. And there was also this Sanjeevani COVID call center where information about COVID and non-COVID related queries could be inquired for. And this was available in the English, Hindi, Odia, Bangla, Marathi, and Kannada languages. There was also an oxygen plant which was installed. They were in Mahmoodabad area hospital in Telangana, in Karnataka, in Korategere government hospital. Do pardon me if I'm getting the pronunciation incorrect. District Combined Hospital in Chandoli, UP. COVID hospital in Chitauni, UP. Jagdalpur Hospital in Chhattisgarh, Sonepur Subdivisional Hospital in Bihar, Bhor Subdistrict Hospital, Maharashtra. There was again some kind of Chitra Rath or mobile van awareness campaign on the same thing, which was done by Oxfam in the Pimpri and Pune Chinchwad block to spread awareness on COVID appropriate behavior. Mission Sanjeevni for rural and urban areas that we had discussed earlier. And Oxfam also ensured inclusion of all communities who remained outside the protection. And they reached out to flood affected communities, domestic violence survivors, single women, small scale street vendors, SC communities, Muslim families, poor families, LGBTQIA plus transgenders, beggars and homeless, informal sector workers, and daily wage laborers. So I guess there is a lot that this presentation covers. And since I am not so well versed with the Oxfam's work, I think it's better that I stop here. What I will do is I will share all the presentations with all the participants so that they can have a closer look. And we would also be coming out with a report for this session, which I'd also be sharing with everybody. So I'll stop here. And we have whatever additional time that we have, we'll use that in the question as I'd like to throw the floor open for questions so that anybody can ask their questions to our esteemed panel members. I see some questions are already in the chat box. Okay, so the first comment or rather presentation, this came from Malakar, and it is about transdisciplinary and multi-sectoral approach being critical. So I think this is just a comment, not a question. Then Nagarajan Krishna, he has this question about why not introduce a basic medical course to cater to the needs of the huge rural population. For example, a nurse or pharmacist level person can identify and tackle the basic diseases and refer to higher institutions. So this is his question. Is anybody willing to take on this question about introduction of a basic medical course to cater to the huge demand for medical professionals in rural areas? Any one of our panelists? Okay, so we'll come back to this question a bit later. There's another question by Anirban Mitra, who says, what are the strategies in job creation after pandemic and economic crisis? So basically, he's talking about livelihood recovery. Would any of our panelists have any thoughts on livelihood recovery after the pandemic? We'd love to hear anyone.
Yes, can I?
Yeah, Tirtha sir, please go ahead.
Yes, this is one of the significant area. If we look at the livelihood, sustainable livelihood, resilient livelihood, just during the aftermath of a pandemic situation in community level. I think spatial allocation of finance is very important. To be localized. We need to actually directly support the local communities with special allocation or special finance that's meant for this vulnerable population, so that we support to them and they can also recover from the problems they come across. There are communities who practices of agricultural activities. There are who are
I think Dheeraj sir's
yes,
can.
sorry, my line was cut actually because of which
Yeah,
I'm
yeah, 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 yeah. It's okay, sir.
okay.
So please carry on. Please carry on with the answer.
Okay, am I audible, right?
Yes, sir. You are audible right now.
Okay. So livelihood, when we talk about or when we visualize the whole spectrum of livelihood in community, there are different sectors. Like many of the families, they are depending on livestock rearing. Many community, they are dependent on fishing activities, fisheries. Many are on agriculture. Many are on business, petty trade, and all. I think those vulnerable and marginalized family, they need special allocation or special financial support to overcome or to rebuild their livelihood activities. We need to have a look at all these strategies when we talk about localizing or rebuilding activities in the community level. I think like of the climate finance, if we can have advocacy plan or program for pandemic finance at the community level, that will be really very important, or I think really going to be very impactful in community level. And then accordingly, the other collaboration with the government authorities, department, national organization and international organization, all these are also really required when you talk about multi-level collaboration and thinking about rebuilding or bringing people's crisis into a recovery position when you talk about the livelihood in the post-pandemic situation. Thank you. Over to you.
Thank you. Thank you so much for responding, sir. Are there any other questions to our panelists? Well, if there aren't, then I'll be a little selfish and I'll ask some of my questions to the panelists. I wanted to give everybody an opportunity, but it seems nobody is willing to make use of that opportunity. So, okay. So my question: do we still have Eileen with us? Eileen, are you still with us?
I am indeed, yes.
Yeah. Hi, Eileen. Thank you again for that wonderful keynote address at the beginning. And two things really struck me from the points that you made about how NGOs are providing this utility function to national governments in their response, or what in an ideal world, how NGOs can actually help governments come out of a soupy situation when it comes to dealing with community outreach and in disengaging with misinformation, engaging with the misinformation that is out there. At the same time, do you also see any kind of pitfalls where certain types of NGOs could actually push the agenda of misinformation inspired by varied interests and motivations? And if that is the case, then what kind of a roadmap do we have to include the quote unquote good NGOs and separate them from the bad apples?
Great question. And, I think my reflections there is what we've seen during the pandemic is that everybody was extremely concerned when it was announced. And there was a lot of misinformation out there, including amongst NGO staff. And I would say would be an extremely small proportion of NGOs who are bad faith brokers and genuinely out there to spread misinformation, although I'm sure it's happened. But I think what we need to recognize as NGOs is that our staff are ambassadors with the community. And if we don't invest in our staff and ensure that they have the knowledge and information and have worked through their own concerns about the pandemic, in a safe space, their concerns about the vaccines, then potentially they will be spreading misinformation with communities. So, it's like when I was CD, we spent as much time investing in ensuring our staff had the knowledge and awareness and information needed and had that safe space to discuss their concerns about vaccination as we were doing with the community, because our staff are people too, and have the same fears and concerns as communities. So that would be my major recommendation, is we invest in staff as much as we invest in our community outreach, because we are ambassadors. And I think that, you know, there's possibly a small amount of NGOs who may be being leveraged and utilized by other actors to spread misinformation. That there can be bad apples, but I think overall we've got most people act in good faith, but we really need to ensure that they have the information.
Thank you so much. That really cleared things up for us. Okay, so is there anybody else who has a question for Eileen, or should we move ahead? Okay, since nobody is asking, I have another question, this time for Dhriti ma'am. Ma'am, in your presentation, you had spoken about the need for integrated and robust systems. So, are we to understand that robust systems are basically those which kind of bring together a lot of stakeholders together and make them work towards a common goal? Or would you define robust systems slightly differently? And can you please give an example for the benefit of our audience?
Yeah. So thank you for your question. It's actually a very good question. So the thing is, when I say systems, I say so. For instance, I was talking more along the lines of coordination and cooperation within departments of say a state government in India.
Yeah.
For instance, an example I wanted to give would be say the case in Odisha when we had cyclones affecting the state during the pandemic. While we had cyclone shelters on the one hand, the issue of social distancing could not be addressed because lack of infrastructure, and of course it was something that nobody had. It's unprecedented whatever happened, but there our social systems need to be such that we need to have infrastructure to accommodate such risks, which will not come one at a time. It will come together, and you need to have systems in place, resources as well in place to be able to take that load and address this accordingly.
Great. Thank you so much. Dhriti ji, you're inaudible. You've made your point, or would you like to speak?
Yeah.
Okay. Sorry. Your voice just got cut off, so I thought maybe it was a connection error or something. I think we've lost Dhriti ma'am's audio. Nonetheless, we were able to listen to the point that she made, and she gave a very good example about concurrent disasters and how when cyclones happened during COVID times, there were people huddled up together in cyclone shelters, and the concept of social distancing was not being practiced during such an exigent time. So yeah, that kind of makes sense on the need of integrated and robust systems. So very quickly, it's 4:30. I do not want to make people stay beyond the time that we promised, but we also promised that we would provide them with a way ahead. I made a promise to Mihir sir for doing that, and he guided us in a right direction to do so. And so did the discussions with all our esteemed panelists. And based on Mihirji's suggestions and the discussions from our panelists, the following points have come up as a way ahead. First of all, there needs to be national planning for preparedness and recovery needs to account for financing for coordination. Just as Eileen mentioned, that NGO workers and civil society organization members above and beyond their normal tasks also need to take out time for coordination, because any kind of activity that is coordinated effectively achieves its goals. But in reality, the allocation of time, money, and resources for such coordination needs to be there. So national planning needs to find the finances to account for such kind of coordination. The second point is the importance or the need for integrated and robust systems. And I just asked Dhriti ji about what are these robust and integrated systems, and she had responded. So I would just like add another uh, another layer of clarity to it. From AIDMI's experience, we see integrated and robust systems as those. They may be bureaucratic structures or they may be systems of administration in the informal sector that kind of gear a community or a group of people working towards the same outcome. So there may be different departments of the same state government that have different objectives, different short-term objectives, but if their long-term objective is the welfare of the people, then they need to come together and have a coherence of outcomes. So that would lead to an integrated and robust system at the national level for effective preparedness and recovery. Uh, then there is the need to embed CSOs in national planning for community outreach and response. Now, this is a very important factor because multiple experiences from our participants, be it Saikya ji from Assam, who said that they've had a vaccination drive wherein they encouraged everybody from the local community to get vaccinated and inoculated. And perhaps there was so much misinformation about vaccines in India that a lot of people, especially in the rural parts of the country, were a little hesitant, and there was a lot of vaccine hesitancy that was observed in India. Uh, the unsung heroes that kind of helped those rural people and rural communities overcome their fear of the vaccine were the NGOs, which is why I say that in order to improve our preparedness, we need to embed NGOs in the national response to any kind of crisis in the future. They need to be in the picture. Then there is the need to address concurrent disasters, as India has a multiplicity of exposed to multiple risks, and there is a multiplicity of disasters that kind of affect India. And geographically, we are diverse and exposed to different kinds of natural hazards. It's only a matter of time when these natural hazards kind of intersect and precipitate into great disasters, not one at a time, but simultaneously. And it was seen through the 2 years that we suffered through the COVID-19 pandemic. I mean, we had two cyclones, one on the east coast and on the west coast. There was Cyclone Amphan and there was Cyclone Taute. Then there were extended periods of cold waves and heat waves across India. This very year, we had the hottest March that was recorded in 100 years. So March 2022 was the hottest March experienced by India in 122 years. So, for these reasons, climate risks, as usual, they compound the impact of existing crises. So, we need to prepare for these concurrent disasters or risks. Then, the importance of bottom-up planning, as was brought out by Eileen in the starting, that she said that a lot of mistrust amongst the people actually originates because they see decisions being foisted and thrust down upon them by governments or the local administrators. Had the process been a little more participative and inclusive and had taken their perspectives and lived experiences into consideration, perhaps acceptance of fiat policy of the government would have been much more easier. So there is a need to institutionalize such bottom-up approaches in any kind of national planning for preparedness and recovery. There is a need for greater funds to finance adaptation measures, and these may be adaptation measures right at the top level with cutting-edge scientific know-how to at the bottom level, which may only involve adopting smart agricultural practices in a small micro-acre farm. So all these needs to be all this needs to be done, and there needs to be money found to be done so. Then there is also the point of expanding the umbrella of social protection. As it was witnessed in India, that a lot of people found themselves in the lurch after the first lockdown because there was a lot of uncertainty. While the government tried to provide succor in the form of various schemes and policies, not everybody knew how to access them. So the idea is to improve or expand the umbrella of social protection so that everybody can come under its net, whomsoever is vulnerable. And the government of India is doing a lot of effort in this regard. Perhaps a little more could be done. So there's always room for improvement. And finally, the point about vaccines. Now that we are in a state where everybody has gotten the first dose, or everybody's has gotten the second dose in India, almost 90%, and people are also getting their booster doses. Perhaps it's also time to improve upon the tracing ability of our scientists in India. Perhaps focusing on things like genome sequencing, wherein we can sequester the genome of the COVID virus and see what kind of new mutations uh, do they bring forth. And that would probably help us in being better prepared for any next wave of the COVID-19 pandemic, or for that matter, any other pandemic. And at the same time, it would also help the entire vaccine manufacturing ecosystem as well as disease prevention and detection ecosystem. So these, in effect, were the 6 or 7 points in the way ahead that came out of this discussion. Uh, I guess I've overshot by 10 minutes. I apologize again. So thank you very much. I'll just end this entire conversation by saying thank you very much for being part of today's roundtable meeting. AIDMI is very grateful that you could find time to come and attend today. We'll be sharing all the resources associated with this roundtable today. A big, big, big thank you to Eileen Morrow, Dr. Kesar Chand, Mr. Basab Sarkar, though he's not here, Dagvoria Tirtha Prasad Saika ji, Ms. Dhriti Pathak, and all participants here too. Just one more request before everybody leaves. Can we please turn on our videos so that everybody can see our blessed faces, and we can take a screenshot of the meeting so that we could say, yes, we were here today. Yeah, just a moment. Wonderful, wonderful. So nice to see everybody. Abhaji, namaste. Deepaji, hi. Ashwati ji, hello. Great, great. Sir, Mihir ji, if you can also, please, just for a moment. Great. So I guess we've gotten the screenshot. Nice to see everybody smiling. I hope my constant rambling did not put you to sleep. So nice to see that people are still waking up. Thank you again. Namaste. And we'll be sharing all the relevant presentations and the report of this roundtable conference with you shortly. Thank you. And be safe. Goodbye.
Thank you.